Of the 4 gynecological cancers that we most commonly see, uterine cancer or cancer of the endometrium is the most common. Cancer of the uterus or endometrial cancer, which is the cancer that arises from the lining of the uterus, it is rising in incidence, particularly in countries like Australia. And the reason for this is the rising incidence of obesity. Unfortunately, the heavier a woman is, the more estrogen she carries in her peripheral fat, and that actually causes some stimulation of the lining of the uterus and can lead to cancer in many cases. The most common symptom for uterine cancer is actually bleeding after the menopause. So it is not normal to have bleeding after periods stop, and any woman who has any vaginal bleeding more than 6 months after she thinks her periods have stopped should seek advice from her doctor and have further investigation. It's not, however, confined to women who are in the menopause, and so women who are not in the menopause may have symptoms related to this type of cancer, usually bleeding in between periods or the periods becoming very heavy. So again, it's important to note what is normal for you, and then if you notice any change, to have that investigated. Again, this is particularly important because we are seeing more heavier women before the menopause, and often these women are actually trying to become pregnant, and an abnormality, including a cancer of the lining, is picked up when they are being investigated for reasons why they can't become pregnant. So something that we really need to watch out for. Fortunately, for the majority of women who have this type of cancer, it tends to be very early. So when I mean early, I mean that the cancer is already confined to the uterus, and it is usually able to be treated with hysterectomy, which is removing the uterus, including the cervix and the fallopian tubes and ovaries. If a woman is suspected of having something like this, she normally has a pelvic ultrasound performed, and if the lining of the uterus is seen to be thickened on ultrasound, she is recommended to see a specialist to have a sample taken from the lining of the uterus. Sometimes this sample can be taken with the specialist in the outpatient clinic by using a very fine sampler that goes in through the cervix into the uterus. For many women, however, they do need to have a general anesthetic so that the procedure can be performed while they are asleep. Once a diagnosis of endometrial cancer is made, it is recommended that further care is delivered by a specialist gynecological cancer surgeon. The reason for this is that surgeon is usually part of a multidisciplinary team, and whenever it comes to cancer care, we know that involvement of a multidisciplinary team, including surgeons, medical oncologists, radiation oncologists, pathologists, radiologists, these are all important members of a team that improve the outcomes for people diagnosed with a cancer. Part of the management once cancer is diagnosed is making sure that the cancer hasn't spread anywhere. We do this by ordering some other investigations such as the CT scan or an MRI, and also at the time of surgery we might take some extra samples, for example from the pelvic lymph glands. After surgery, once all of the information is available, some women will require further treatment in the form of X-ray treatment, which is radiotherapy. This is usually given from the outside to the tummy and the pelvic area, and some women will also require some chemotherapy, which is a drug that is given in through the vein. But fortunately, the majority of women will likely be cured with surgery alone. So in summary, if you or someone you know has been experiencing any new bleeding after the menopause, or you're concerned that your periods have become increasingly heavy, or you are bleeding in between periods, I would encourage you to see your general practitioner or specialist to have some further investigation.